right, it's now time for Ask the Expert. February is Heart Disease Awareness Month.
And one way to keep your heart healthy is by exercising and lifting weights. Wellness Ambassador David Pritchard joins us live this afternoon. Not many people put heart health and lifting together.
No, they don't. Well, obviously, we think about eating well, which we should, and less sodium and less saturated fat and things like that. And we also think about getting on the bike and getting in the gym and doing cardio, which are great pieces to the puzzle. But as we see all of these studies starting to come out on prevention of heart disease, strength training is becoming top 2 or 3 now, and ways to do it. And here's why. It lowers fat intake. It lowers your fat on your body. So it increases muscle mass. So it helps reduce blood pressure. Okay? Helps you overall your health, helps circulatory system in your body. So it's one thing that we don't do enough of and we don't talk about enough when it comes to heart health. So what I wanted to do is I want to show some of the common movements when it comes to lifting weights. And you know, obviously it's fitting it into cardio and eating right. Then you have the whole picture. And these 4 movements I want to show are just basic movements. You know, the chest press, the back row, a squat with a shoulder press, and a lunge with a side lateral, because those are things that anybody can do anywhere, at home or at the gym. And it's really easy to do, and it will help include that piece that you need.
And you've brought your mini gym here to the
I brought my
studio
mini
to show
gym.
us just what we should be doing.
It will show you exactly what you need. Obviously, a pair of dumbbells and a bench. You can use a ball. You can even use the floor.
You need a spotter?
Certainly. I make sure I went a little light, you know. So when we think about a chest press, we think about going nice and slow on any lift that you're doing. But this is going to work that upper body, which is really good, not only just for heart disease, but just for strength and bone density. And using, you know, weights are going to help all of that. Now, the other one, which I really, really like, is a one-arm row. This is really good for your back. It really helps your posture. It helps your, again, your core. And again, these are exercises that require you to do a lot of work.
Now, are reps important?
They are important. Now, you can go 12 to 15 reps, because I don't want you to feel like you can do 100 of them. I want you to be challenged. I want it to be something that challenges your body and gets you out of breath a little bit. Okay, now one of my favorite ones is simply a squat and then a shoulder press. A squat and a shoulder press. Again,
now, are you also bringing in the glutes when you're doing coming up?
I'm pushing my butt back, pressing through my heels of my body so my knees are safe. But when I think about heart disease, I'm getting my heart rate up, thinking about blood pressure. And final, which is another one that's definitely going to get your blood pressure up, is a lunge, going down slow. Again, these are common movements everybody can do.
Now, you go to the gym, I go to the gym, but one of the big things as women, they're scared to lift weights.
Exactly.
They don't want to bulk up.
Yes.
But that's not necessarily,
that's false.
yeah, right.
That's false. Remember, muscle is going to help your metabolism. The more muscle you have, the more your metabolic rate goes up, which not only helps with body fat, helps with your heart. It helps with your heart. So we want to include these pieces in, and trust me, you will lean up. You're not lifting really, really heavy weight. You're lifting lightweight but challenging weight that works the whole body.
All right, perfect. Well, if you have a question for our experts, email them at asktheexpert@todaystmj4.com. You can also leave a voicemail. That number listed right there on your screen. We'll be right back.